This is a model of a dog's left knee, and I'll show you on the model what it is that happens with the whole cruciate ligaments and what I do to repair them. The cruciate ligaments sit down deep inside of the knee. They sit right there in the middle. And they're crossed ligaments. Crucifix and cruciform and all those words mean cross. So the crucia of cruciate means crossed. But they're ligaments that sit in a direction like that. There's a front one and a back one. We call it a CCL in a dog because dogs are cranial and towards their head when they're standing down on all fours. It's the exact same ligament though as the anterior cruciate ligament in a person. In a person towards the front of the anterior. But same ligament basically, same function, just different name. It's almost always the front one that tears. And what the cruciate ligaments do is they prevent a front to back motion. A knee isn't really a very stable joint. The only thing that keeps it functional is all the ligaments that hold it in place. And when you tear the cruciate ligament, which is a very common injury, then you get this sliding motion that creates a lot of inflammation in there, and it wears on the meniscus that sits on each side, which is people who've torn their cartilage have usually torn their meniscus. So what I do to repair this is it's something that's adapted from a surgery that's done in people. I originally got this from Dr. Stan James, who did a surgery on a dog in my hospital, and I like the repair, and I've done the same repair, I've just done it in a little bit more dog-friendly manner. But basically, you take a piece of this ligament that holds the patella in place, the kneecap, and we create a strip that creates our new ligament. And to suture this in, I put sutures in this new ligament that are in a cross-stitch pattern. That way the pull is across the fibers of the ligament. And I can usually get 5 on a reasonable-sized dog. And those sutures go through drill holes that come in from the outside of the knee, one high and one low, and they end down in here in this little fossa. So the sutures, one end of the suture goes through one hole and the other through the other hole, and then they're tied across the outside of the bone. So that creates a nice, sturdy attachment. That ligament ultimately grows into the bone, and then the sutures aren't needed, but that takes several months.